Our series on suicide prevention, produced in part by the social service worker students at St. Lawrence College, continues. Here's the third part.
Hi, my name's Ashley. I'm an SSW student with the St. Lawrence College. We're here with our community initiative to talk about suicide and promote it in a positive light with our Cornwall services. Today I have Roxanne Ferguson with the Eastern Ontario Health Unit and the Suicide Coalition. She's a health promoter. So, hi, thank you for coming.
Thanks for having me.
So to start off, I would love to hear about your mandate and the population that you guys serve.
Okay, so for the Health Unit, our mandate is to really promote health, protect the public's health, and to prevent, chronic diseases and injuries and things. And so that's how the suicide prevention fits into our mandate, is in the injury of prevention. And the population that we serve is pretty much all across the lifespan. So we have a big focus on early years, so 0 to 6 years, but also for, all ages.
So the older population.
That's right.
Perfect. So what are the services that you guys provide in regards to suicide or mental health?
So we have suicide prevention initiatives, and one of our biggest initiative was to participate on the Suicide Prevention Coalition of Champlain East. And so we were there in the very beginning. In 2010, we had released a report, the injury report, which stated that we had a higher rate of suicides in our community compared to the Ontario rate. And so that prompted us to reach out to CMHA. And from there, we decided to start the coalition. Mm-hmm. And since then, we've had a lot of successful projects and campaigns with the coalition. And one of the biggest things that came out is the reachoutnow.ca website, and on there's all kinds of information if you're looking on where to go for help, how to reach out to somebody who is in need of help, how to get help for yourself, and also different trainings that are available if you're looking to get trainings. And I'm an assist trainer, so part of my role at the Health Unit is to make sure that all of our nurses and any staff that have direct contact with clients, that they have the applied suicide intervention skills training. And so, and we also offer this training to the community. And we also have somebody at the Health Unit who is a Safe Talk trainer, which is another great training for the general population who wants to know how to recognize the signs of suicide.
There's a lot of wonderful things that you just said.
Thank you.
Definitely with the expansion of the Suicide Coalition, how much they've already put into our community, I've definitely seen a change and have heard of them before. Having one website too with all the information that you can reach into and help, whether it's for yourself, for somebody else, or even if it's a family member saying like, I'm so overwhelmed, what do I do? It's another really good resource.
Yes, exactly.
And last, I just wanted to say on that is that with the assist training and the Safe Talks, especially with our first responders, if we've seen that a lot more come lately, which is really helpful. So yeah, and that brings me into our last question for today. How do individuals in the SDNG and Cornwall area access your services?
So the Health Unit has an office in, we have 5 different offices. So we have one in Cornwall, Winchester, Alexandria. We also have some in Prescott Russell, so Castleman, Hawkesbury, and Rockland. And so you could always access our offices and go looking for our services through the office, or call. We do have a Healthline phone number, which I could leave with you. And so you could call this number and you'll get the answers that you're looking for. And I also wanted to just mention that although a lot of our programs are focused on improving your own physical health, we know that physical health and mental health go hand in hand. So if you feel better, you're more likely to have a positive mental health and better well-being. So, from quitting smoking services to Healthy Babies, Healthy Children services, we have a whole host of different services to help the general public.
For sure. A lot of people don't realize that everybody has mental health.
Exactly.
And it depends on what spectrum you're at. You don't need to have an illness to make sure that you take care of it well.
Yes.
So a lot of the time you want to take care of it before it gets to
Exactly.
the extreme levels, which is really good. And so definitely with those services for sure. So I would just want to thank you so much for coming on to the show today, and thank you. You gave a lot of good responses, and so
Thank you
very
for
much.
reaching out to us.
Thank you.